Let's be real, dental implants are a huge investment, not just financially, but in your health, your comfort, and your confidence. So the idea that they might actually need fixing can be, well, a little unsettling, right? Today, we're going to walk through exactly what to do if you run into a problem, and more importantly, how to protect that investment for the long haul. And if you feel that way, you are definitely not alone. This is such a common reaction. I mean, we hear all the time that implants are this permanent, lifelong solution, so hearing that they can have issues, it can come as a real surprise. But it's a reality we need to be ready for. Okay, so the first thing to know, and this is really important, is that the odds are overwhelmingly in your favor. Dental implants have an incredible success rate. We're talking over 95%. So problems are absolutely the exception, not the rule. This is a highly reliable procedure. But that begs the question, doesn't it? What if you do find yourself in that small percentage? What are the signs? What are the solutions? And what does that road back to a healthy smile actually look like? That's exactly what we're going to break down right now. All right, section 1. Let's get right into it by understanding the warning signs your body might be giving you. Honestly, knowing what to look for is the single most important step in getting ahead of any potential issue. So problems can kind of pop up in two different ways. On the left, you've got the big, loud, immediate red flags. Things like sharp pain, a tooth that's obviously loose or swelling. These are your call the dentist right now kinds of signs. Then on the right, you have the more subtle stuff, the things that might creep up on you over time, like a small change in your bite or food getting stuck where it never used to. Both are equally important to pay attention to. Let's start with the big one, pain. And I'm not just talking about a sharp pain when you bite down. It could be a dull, constant ache or even a new sensitivity. Any of these feelings are basically your body's primary alarm system going off. Okay, next up. Does anything feel loose? Any feeling of instability at all, whether it's the crown wiggling when you eat or maybe you hear a little clicking sound when you chew? That is a major warning sign that something needs to be checked out. Look, the bottom line here is this. Don't wait. Don't just hope it goes away on its own. Whether it's one of those big red flags or just a subtle little warning sign, getting it checked out by a professional as soon as possible, it almost always means the fix is going to be simpler, faster, and way less expensive. Okay, so we've spotted the problems. Now for section 2, how do we actually fix them? And here's the good news. Most problems that pop up with dental implants are absolutely fixable. The real key is just correctly identifying what's causing the issue in the first place. So, the most common reason an implant feels loose, it actually has nothing to do with the implant that's in your bone. It's when the parts on top, the crown, which is the tooth part, or the abutment that connects it, have just come a little loose. Think of it like a loose screw on a piece of furniture. Simple fix. Okay, this one, on the other hand, is the more serious situation. A loose implant fixture means the actual titanium post, the part that's supposed to be fused with your jawbone, isn't secure anymore. This is a problem with the foundation itself, and you've got to get it looked at right away. And as you can see here, this difference is absolutely critical. A loose crown, that's just a minor mechanical issue, usually fixed by just tightening a screw. But a loose fixture? That's a major biological problem. We're talking about the bone itself, which could require grafting or a full replacement. That's a huge difference, and it's why you can't just wait and see. So what happens in that worst-case scenario where the whole fixture has failed? Well, it's not a quick swap. There's a very deliberate, staged process. First, the failed implant has to be removed. Then, your body just needs time to heal. We're talking months. Then, they might need to rebuild the bone foundation. And only after all of that can a new implant go in. See, every step is there for a reason, to maximize success the second time around. And, the costs really tell the same story. A minor fix, like just tightening a screw, might only be a couple $100, but a major replacement, yeah, that can run you thousands. This really hammers home why catching problems early is so important from a practical standpoint. All right, section 3. You've had the treatment, the implant is fixed. What now? Let's talk about what recovery looks like and, probably the most important question, what are the chances it'll actually work for the long run? And the news here is really good. The outlook is super positive. Minor mechanical repairs, they're almost always successful, like 95 to 98%. Even for the more complicated stuff, like treating an infection around the implant, a condition called peri-implantitis, the success rates are still fantastic. And even a full replacement, A second implant works 85 to 95% of the time. The takeaway here is these treatments work. But, and this is key, good results take time. You've got to have realistic expectations for healing. Treating an infection might feel better in a few weeks, but if there was bone grafting involved, you're looking at 3 to 6 months for that new bone to get strong. A full replacement from start to finish, that could be a 6 to 12-month journey. Patience really is a virtue here. Okay, last section. We've talked about how to spot problems and how to fix them. Now for the most important part of all. How do you avoid them completely? Because, as they say, the best medicine is always prevention. Your daily routine, that's your #1 line of defense. And this isn't rocket science, you know? It's just about being diligent, brushing the right way, using a water flosser to really get around the implant, and just being smart about what you're eating. And seriously, your implant is not a bottle opener. Don't do it. And look, you can't do it all yourself. Getting professional maintenance is absolutely non-negotiable. Especially in that first year after you get an implant, your dentist is going to want to see you pretty frequently. After that, every 6 months is the bare minimum to make sure everything's holding up. Yeah, we have to be really blunt about this one. Smoking is probably the single worst enemy of a dental implant. It just wrecks the healing process, it cuts off blood flow, and it sends the risk of infection and failure through the roof. If you really want to protect that implant, this is a habit you've got to address. So, let's wrap it all up with this thought. A dental implant is an incredible piece of technology, right? It's a massive investment in your quality of life. And the power to make it last a lifetime, well, that's pretty much in your hands. It comes down to daily care, regular checkups, and just listening to what your body's telling you. So the real question to ask yourself is, are you doing everything you can to protect it?